you a while to get sensitive with your elbow, so you have to be really careful. But what I try to do is I try to find the trigger point. I'm just gonna go,
Lean into it.
tell me how that feels. You need to communicate with me.
Pressure.
Do you have radiating pain at all?
I'm starting to feel it.
Where?
Up my neck.
All right, can you show me with your right hand?
Right.
She's like,
No, like, it's on the left, I assume, right?
Yeah.
Okay.
Like kind of. Well, in a certain position you were in, it kind of went away now.
Okay, I'll see if I can
There
find
it
it.
is.
Oops. Here?
Yeah.
All right. So can you tolerate that?
Yeah.
If I hold it. So she's getting a true radiating pain, so it's a true active trigger point along more of the origin of the upper trap. So I'm gonna see if I can hold that pressure. And so what I'm gonna wait for is either for that radiation of pain to go away, because I want it to centralize and come back under my elbow, and or sometimes I feel a big heat release from the tissue.
If you drink.
Or sometimes I feel the muscle just literally go, just like relax under. Yeah. So yeah, sometimes I do stretch with it, but I'm just gonna start with some basic. And some people actually put the muscle on slack and do the trigger point. That's called Jones strain counter strain, where you actually work not stretching the muscle, actually put it on slack. It works really well for like hip flexors and whatnot. So how are you doing?
Good.
Okay, so what does that mean? So is the pain still radiating?
Yeah. So
Okay.
bad.
Huh?
No, it's fine.
And on a 0 to 10 scale, 0 no pain, 10's the worst pain you can imagine to have. Give me kind of a number or a range where it is with my elbow in there.
Probably a 2.
Okay, so that's
It's not
that's
too much.
fine. So I try not to go over a 6 with people, because I find if I go over that, then they're like tightening their body. And so what am I trying to do? So I may try to go, what happens if I go a little bit harder? You get any more radiation? Or no?
It actually kind of went away because I feel like
It moved a little
yeah,
bit.
you shifted
Yeah.
your.
Sliding.
Yeah, it is.
Yeah. Oof.
there it is.
Is that
Yeah,
radiate?
Yeah.
What number on a 0 to 10?
Probably a 3.
Okay, so I would hold that, and sometimes it takes a few minutes, at least 30 to 60 seconds. Russ will tell you that this quarter with his stretches. But I wait until I feel a change in the tissue, so I can't tell you how long that is. It's getting hot under my elbow.
Is that just a friction though from your elbow and her skin? Or?
I'm trying not to. Sometimes I'll actually move it. I feel like it's more of a release from her tissue.
So when you're just you just press down on it.
Yeah, and it's active. So do you still have the radiation?
A little bit, yeah.
Okay.
It's kind of dissipating.
Okay.
So-
And so a lot of times my patient will take a breath, or sometimes I'll take a breath, because I'm very in sync with my patients, and that means that they've gotten a relaxation of the tissue. So I'm just gonna come off it. So of course I would have done an evaluation. I would have looked at her neck range of motion. So before I do something else I wanna try, let's just look at her side bending range of motion, and I wanna try something and see if it makes it better. So sit up straight, do a chin tuck. Yeah, so can you bring your, an ear to a shoulder? Okay. And how does
While I'm doing the shin tuck, or?
Yeah, I want you to stay in good posture. So, yeah, what do you feel, other than a
Just
stretch? You
stretch,
can
yeah.
see the stretch there, and then can you go the other direction? Okay. And can you go back to the right? Do you feel a difference from right to left?
The right makes things
Try it again for me, each direction.
She's like, I don't know.
Yeah,
As far as a degree, or
yeah.
maybe a little more on this side?
Mm-hmm. And then can you turn and look over a shoulder? Okay. Yeah, and go over the other shoulder. All right. So let's just do, it's called an active release technique. So, and it's red, the area of the trigger point, by the way, which is normal. So what I want you to do is bring your left ear down to the left shoulder, and I'm gonna pull the slack in the tissue with my left hand. Can you bring the right ear down? So she's as much as you can. So you're gonna feel the stretch. So it's an active release, meaning I'm holding the fascia, but she's actually actively stretching. So I allow the fascia to let go a little bit so she can get the range of motion. So bring your left ear down again. I grab the fascia, kind of hold it down, and you bring your right ear down. Keep going, keep going. So I lighten up a little bit so she can actually do the range of motion. I'm not holding it, so I'm preventing her from doing the range of motion. And bring the left ear down again. So I grab her upper trap, pull back a little bit, and bring the right ear down. You okay?
Mm-hmm.
All right, and then here again. Yeah. And this is something that I do on myself a lot, and if your neck is feeling tight, you can really loosen up your neck pretty nicely. And let's do one more on the left. Bring the ear down, I'm pulling the fascia, and go to the right. And stretch as much as you can. Okay, good. All right, she's just very tight fascially, the whole muscle besides the trigger point. So now bring your right ear down. I'm gonna try the same thing. I'm holding, I'm anchoring, and bring your left ear. You're gonna stretch, and I'm allowing her to do the range of motion. And let's do about 4 more repetitions here. Yeah, and come down here. You okay?
Mm-hmm.
Does it feel different from one side to the other? And right ear down. I can't hear you.
Not really.
Mhm. I feel there's much more of a pull when I was over here and she was stretching the right side than the left and right. Left, yeah. And one more time, yeah, and left. Okay, and look straight ahead. And then something else, and we'll learn this when we get to massage, is can you look down, chin to chest, as much as you can. And she's very tight. People are very tight around the C7, T1 junction, and this is called the picking up of the tissue. And what you're literally doing is try to pull the tissue
From the muscle.
away from the skin, and she's very, very, can you feel how tight
does that
that is?
Really
I
good.
love it. I love it because most people have a forward head posture, and so when you have that forward head posture, you slam your OCB, your occipital cranial base, you compress, and so this feels really nice for people too, especially right in here, and look straight ahead. So now, all right, do you do okay with cold?
Should volunteer more often.
Yeah. Do you do okay with cold?
Yeah, yeah,
All right, so
yeah.
now an ice massage.